So let's review a little bit from our last session. I went over postpartum psychosis and intrusive thoughts, and we learned that postpartum psychosis is the most severe postpartum mental illness. Things that are unique to postpartum psychosis are delusions and hallucinations. And we also learned that intrusive thoughts are common in the general population and in also new mothers.
Last session, I discussed breastfeeding. I went over some facts about breastfeeding, such as 75% of mothers in the US start out breastfeeding, and at the end of 6 months, only 43% breastfeed and 13% breastfeed exclusively. I also went over some benefits of breastfeeding, which include that it protects against a variety of diseases and disorders, it decreases the risk of SIDS, it promotes secure attachment, it has hormonal benefits, physical benefits for the mother, and it encourages oral motor skills and development for the baby. I also went over how to properly latch a baby, and I included a video in my presentation as well. I also went over how OT can help. So occupational therapy can help establish new habits and routines for you to manage your time while breastfeeding. We can assist with positioning and attachment. We can educate and provide resources as well. We can support the care of the mother, the infant, and the family. We set realistic expectations, and we help form positive coping strategies and increase your confidence in breastfeeding your child. Lastly, I included some support resources that you can look back at that module and look at. In today's presentation, I'm going to discuss toddler feeding in depth. By the end of this presentation, you'll understand proper positioning during feeding your toddler. You'll be able to identify tips for starting solid foods, finger feeding, spoon feeding, and cup drinking with your toddler. You'll define and describe a picky eater, and you'll be able to list ways to help picky eaters. So to start off, positioning during feeding is key. Your baby should be sitting independently on the floor before you start food, but don't expect them to have long sitting endurance in this position. Some additional support may help them feel comfortable. No matter what high chair or booster you purchase, it's important to consider the body mechanics and stability principles of your child. We're looking for 90 degrees at the hips, knees, and ankles, and a support under the feet. Make sure your child does not lean to either side. If they do, consider adding a rolled up pillow or towel. If your high chair is too big for the baby, add a small towel roll behind their back for added support and stability. This is similar to adding a pillow behind your back if you can't reach the backrest on a chair. Ensure that your high chair or a booster has a footrest that reaches their feet. Most chairs have an adjustable footrest that reach many 6-month-olds' feet. If you need to modify the footrest, use a tissue box, a Ziploc bag box, or pull noodle and adhere it to the chair using duct tape or double-sided Velcro. You can also use an exercise band around the legs of the chair to create more stability in the feet if the high chair is not equipped with a footrest. If your child is leaning backwards in the chair, try to reposition your baby's hips and get the baby to be leaning slightly forward into a positive tilt position, just like you would lean slightly forward when eating your food. This position is also known as an anterior tilt and places the trunk into an ideal upright position with the shoulders directly over the hips. Your child's mouth and jaw work more effectively when they're well positioned. Make sure that the tray of the high chair or booster is at the right height for your baby to reach the food. It should be chest height or below. If your baby isn't tall enough or doesn't have long enough arms, consider adding a small towel beneath your baby to allow them to reach food on their tray or the table even better. Many high chairs and boosters come with a recline feature. This is not a necessary feature as we never want children to eat solids, including purees, in a reclined position. Here's a video of the proper positioning for a baby. It gives you a visual of what I just talked about. Depicted on this slide are more examples of proper positioning for the baby. These include incorporating footrest specifically. So in the first picture on the far left, they placed a dining chair under the high chair so the baby could put their feet on the chair as the footrest, which is a great way to utilize resources you have at home. And in the next two pictures, they have an exercise band wrapped around the high chair for the baby to use as a footrest as well. Next, I want to give you some tips for starting solid foods. So once your infant is approved for solids by your pediatrician, gradually begin to introduce foods in the order suggested by your pediatrician. This is typically around 4 to 6 months of age and may also depend on if your child is able to sit upright and alone on a stable surface. So encourage your child to mouth a variety of infant-safe objects to prepare their mouths for chewing. Ensure proper alignment with head support, good head trunk control with their hips and knees at 90-degree angles. Allow your child to get the food on their hands and bring it to their mouths themselves so they can prepare for its smell and taste. Provide your child with 2 to 3 spoons or toys at a time to scoop food and play eat. This makes mealtime exciting. You can use one and then they can try to self-feed or play with the others. Some children prefer to have small portion sizes on their tray or table in front of them at a time. If you have more on their plate, it may be more overwhelming for them, and they can always have more if you introduce a little at a time. Expose your child to a variety of smells. If your child is already sensitive to smells, learn what they prefer and avoid, and help them cope with that smell by introducing it slowly. Next, I'm going to talk about finger feeding. So you want to be aware of safe finger foods for your infants and toddlers. Beginner finger foods should easily melt in a child's mouth. Cut these foods in long strips or a variety of larger shapes and sizes to help your child learn more about different ways to hold their food. Your child may hold on to a food for a long time at first, sucking more than chewing. Your child is still learning how to release objects from their hands, so this is normal. Provide your child with 1 to 2 foods at a time. They can always have more. It is sometimes overwhelming for a child to see so much food on their plate or tray. If you'd like to work on your child using their index finger and thumb together by picking up a Cheerio or yogurt melt, provide them with a few spread out at a time. Otherwise, they may try to scoop them up with a gross grasp all at once. Moving on to spoon feeding, you want to first introduce the spoon as a play object during meal times as early as possible. Let your child explore this object before you try to put it in their mouths. You may need to help guide the spoon to your child's mouth by helping to hold the spoon. Try to help them first by scooping the food out of the bowl and then letting them bring to their mouths by themselves. As they progress, you can gradually let them scoop their own food. You may need to hold on to the spoon at the same time as your child to help them self-feed in the beginning stages. Once the spoon is in their hand, place your own hand underneath theirs and guide them in the feeding process. Some children are hesitant of hand-over-hand feeding, which is what I just described, meaning you place your hand over and around their own. So by placing your hand under their hand with the spoon, they can feel more confident and independent. If your child can scoop food and bring to their mouth but needs a little bit of help, try supporting at the elbow. Moving on to spoon feeding, you want to introduce the spoon as a play object during meal times as early as possible. Let your child explore this object before you try to put it in their mouths. You may need to help guide the spoon to your child's mouth by helping to hold the spoon. Try to help them first by scooping the food out of the bowl and then letting them bring it to their mouth by themselves. As they progress, you can gradually let them scoop their own food. You may need to hold on to the spoon at the same time as your child to help them self-feed in the beginning stages. Once the spoon is in their hand, place your own hand underneath theirs and guide them in the feeding process. Some children are hesitant of hand-over-hand feeding, meaning you place your hand over and around their own. So by placing your hand under their hand with the spoon, they can feel more confident and independent during feeding. If your child can scoop food and bring it to their mouth but needs a little bit more help, try supporting them at the elbow. As far as cup drinking goes, parents often purchase sippy cups with spouts as a child's first cup. Although these cups work for some children, drinking from open cups, straw cups, or cups with a flat lid, also called 360 cups, are best. You may need to support more at first until your child understands how to drink from a cup. You can fill the cup up halfway instead of filling it to the top. If your child has difficulty drinking when the liquid pours too quickly, try using a watered-down smoothie, yogurt, or other pureed food first. Slower flow rates are easier to manage than water or milk, and it gets them used to drinking from a cup. A few reminders for self-feeding. You want to incorporate play activities to help your child with self-feeding skills. These activities can include dump and pour activities, using measuring cups, spoons, bowls, drinking cups, etc., to work on manipulating objects to carry over to spoon feeding. Finger painting also gets your child used to a different texture and lets them know it's okay to get their hands messy. Blocks can increase hand-eye coordination and grasp, which can carry over to spoon feeding. Velcro play food builds hand strength and enhances pretend play skills. A pretend picnic with feeding stuffed animals using a spoon or cup can encourage fun practice with these skills and make using a spoon or cup more fun. Coloring, also while using crayons, markers, chalk, or more, is a great way to enable your child to use one hand at a time, which can carry over to drinking from a cup with one hand rather than two, or using a spoon. And it's so important to expect mess. Making activities fun and functional for your child is important. You can always clean up after the activity. You can also encourage them to help you clean, which is great for fostering their independence. So with some kiddos, feeding just isn't that easy. Some toddlers are really picky when it comes to eating. When a child eats a limited variety of foods, is unwilling to try new foods, and/or eats slowly and deliberately, this is classified as picky eating. What causes children to be picky eaters? Many children are picky or fussy with food. As long as your child is eating a range of foods from different food groups and developing well, this may be a phase that they could grow out of. But there are several different reasons behind fussy or picky eating habits. Some difficulties with feeding can relate to touch, taste, smell, or co-coordination of a child's body or mouth and tongue movements. Some children can be sensitive to certain food textures or tastes, and you might see the following. They may avoid particular texture, temperature, colors, strong flavors, and smells. They may prefer familiar, safe foods. They may have difficulty with self-feeding to avoid mess, sticky fingers, and faces. They may dislike food touching on the plate. They may have a preference for dry foods and avoid sauces. They may have a real anxiety response to food. Other children may overload their mouth. They may keep food in their mouth for a long time, which is known as pocketing. They may want to have lots of crunchy or chewy food and avoid the bland foods, or the opposite. Some children find it hard to keep food in their mouth. They may have difficulty with the action of biting and chewing. They may gag or choke on foods, and they might struggle being able to suck through a straw or drink from a cup. On this slide, I have a video of how to handle picky eating in toddlers. So what can we do for picky eaters? What can occupational therapy do? What can parents do? We can incorporate the strategies on this slide. It's all about trial and error. So first, we want to make food fun. It's not always about eating the food, just being comfortable with it. You can have teddy bear picnics for your children. You can make cooking and baking creative. You can make smoothies with them. Use food in messy play. Play a game with feely bags, which guess the food you're touching. Do a taste, smell, and match experiment. Try and match the flavor to the picture. And do science experiments with food. After exploring new foods during play, slowly introduce new tastes at mealtime. Let your child see and smell different foods that you eat. Be good role models. Use a tasting plate for the whole family. You can pick from it if you want to. Put different foods on or near your child's plate without expecting them to eat them. Tolerating them on the plate initially can be a big step in itself. You can also use food chaining, which is making tiny changes to the type of food offered. So if your child loves McDonald's French fries, introduce home-cooked French fries until they like that. Then introduce chips until they tolerate that. Introduce chunky chips, and then potato puffs, and then mashed potatoes. You may only add a few pieces of the new food item at a time. This process may take a few weeks and months, but be patient. Involve your child in the meal preparation, even if they don't taste it. You can give cereal a bath in milk with your toddler. You can make models out of foods, make pepper trains and banana boats, and make pizza faces, and incorporate special interests such as favorite characters or colors. Reward even the smallest steps in the right direction. With the touch it, kiss it, lick it method, they first touch the food with their fingers. On another occasion, they bring it to their lips, maybe giving it a kiss or having a lick, before ever consider eating the food fully. If they touch, kiss, or lick the food, offer a reward. Keep feeding positive. Focus on the positives. Reward for tiny steps. Involve your child as much as possible. Find ways to make eating a you can do this experience. Use a reward chart that is kept in a visual spot at home. Each time your child does something well, put a star on the chart. Tell them what their reward will be, and that they'll get a star each day. Reward them at the end of the week with a small treat. Give your child some control. Serve meals family style by serving the different foods and bowls on the table and allowing each person to help themselves. This gives the child a sense of control and also slows down the pace of the meal. It helps children who become overwhelmed when food is presented to them already served up on a plate. Don't force your child to eat new foods. Allow them to pick out new foods of their choice at the supermarket. You can have an older child do this experiment as a food experiment. So this would be a child older than a toddler. And then let them make a food diary, record new foods they like or have tried as they move on. And you can make this a food book as well for toddlers. Think about how and where your child sits to eat. Can your child see what is on their plate? Is the table at elbow height? This is taking positioning into consideration, making sure their feet are supported and on the floor. Are there lots of unwanted distractions around them? Example, TV, busy people with other activities. Does your child struggle to sit long enough to eat? If so, consider a more supportive cushion or chair. Keep meal times between 20 and 30 minutes. If it hasn't been eaten by then, move on. Build up trust. Don't be tempted to hide or conceal food. Children need to trust you and know that they are safe with the foods that they are eating. Stick to a predictable routine. Have 3 meals a day at set times and eat with your children at the dining table if possible. Space meals 2.5 to 3 hours apart and avoid allowing snacks in between. Many children don't feel hunger or build up an appetite as they graze and snack all day. Increase your child's awareness of their mouth and tongue. Try activities like blowing through a straw, party blower or party whistle, blowing bubbles, sucking drinks through a curly or clear straw. Try thicker liquids too, such as milkshakes or smoothies, to build up these skills. Massage the cheeks, puff out the cheeks, mouth noises, smacking the lips together, clicking, clacking the tongue, singing la la la, ma ma ma. Count the teeth by touching them with the tongue inside the mouth while they're looking in the mirror. Make silly faces, stretching, pouting the lips, moving the tongue to do so. Consider ways of calming coping before, during eating. Try some calm down activities before meal times, maybe wearing a weighted lap pad or shoulder wrap. Always put something familiar on your child's plate. Consider a divided plate for children who prefer to have their food separated. Offer new foods in a separate bowl to allow the child to serve themselves. Have a drink available as well. So ultimately, this list it can be for toddlers, preschool children, and maybe children as they get older if they stay picky eaters. But just keep trying strategies with your child. It takes time to figure out what strategies will work or will not work. It's important to work on feeding strategies at every meal. Occupational therapy can help you come up with new and great strategies as well. So here's a knowledge check question for you. Select all that apply. What is the proper position for your child during feeding? A. For breastfeeding in a cradle hold, always bring your baby to the breast and let them latch themselves. B. For breastfeeding in a cradle hold, always bring your breast to the baby and help them latch. C. For eating solid foods, sitting at a right angle in a seat or high chair. Or D. For eating solid foods, sitting in a reclined position in a seat or high chair. So the answers are A and C. A, I went over last session. For breastfeeding in a cradle hold, always bring your baby to the breast, but let them latch themselves. Let them have that wide open mouth and and get themselves to the nipple. And for eating solid foods, I went over this during the session today. Sitting at a right angle in a seat or high chair is what you want. You want 90 degrees at the hips, knees, and ankles. You never want to let your child eat in a reclined position. Attached to this slide are some resources for you. So the first one are some handouts on picky eating. The second one is some Pinterest hacks for picky eating and some picky eater recipes. So you can see depicted, they made a face out of grapes, celery, and peanut butter. They have alphabet, it looks like noodles of some sort. They made a heart and sprinkles in a sandwich. Just making food fun, colorful, and something they may want to eat. There's also a book called Deceptively Delicious, Simple Secrets to Get Your Kids Eating Good Food. This is by Jessica Seinfeld, and it's a great way to get your child to eat a little healthier, get a little more nutrition in them, but by disguising those veggies. So she makes muffins with vegetables, there's cookies, there's I'm pretty sure there's more than just desserts, but there's things that are more visually appealing to your child's eye, but they are actually healthier for them. So take a look at those resources on your own time.
So in this module, I'll be talking about postpartum anxiety and OCD. So I wanted to go over some general definitions that I may bring up throughout the course of this module. So first we have postpartum anxiety, otherwise known as PPA, and that is excessive worry and is accompanied by restlessness, fatigue, poor concentration, muscle tension, and sleep disturbance, and this can be present after birth. Next, we have generalized anxiety disorder, or GAD, which is what we think of normally when we hear the word anxiety, and that is diagnosed if those symptoms persist longer than 6 months. Then we have postpartum obsessive compulsive disorder, or POCD, mostly referred to as OCD, and that is intrusive images or thoughts, as well as repetitive behavior or thought patterns, what we call compulsions, that are aimed at reducing that anxiety. In those who are diagnosed with postpartum obsessive compulsive disorder, usually have an onset of the symptoms between 12 and 26 weeks after delivery, but it can occur immediately after birth. Postpartum anxiety occurs within 10 to 18% of new mothers. 14% of mothers with postpartum depression also have postpartum anxiety. In OCD, 3 to 5% of new mothers and some fathers actually experience this. Approximately 27.5% of women have a comorbid anxiety disorder. And then 70.6% of women have a comorbid depressive disorder. So all of these different mental health diagnoses all kind of weave together, especially between anxiety, OCD, and depression. Let's go over some symptoms that someone may experience if they are suffering with postpartum anxiety. This can be excessive worry about a child's development or safety, feeling of being on edge a lot, maybe feeling a sense of danger, insomnia, changes in heart rate or breathing, nausea, and also dizziness. What are some risk factors for being diagnosed with postpartum anxiety? So we want to look at personal or family history of anxiety, or how someone in your family may have handled their postpartum experience. Having lower social support. So this is why I always preach that having people around you is very important, whether that means um, maybe some friends and family, or even joining a support group. Having a crisis in housing, job, or finances. I've also found crisis in relationships can be a risk factor for anxiety. And then, of course, a history of endocrine dysfunction, so thyroid disorder or diabetes. So then again, we have the balancing of the hormones. So like I was talking about before, that estrogen and progesterone has a lot to do with it, but there's a bunch of other hormones that can really affect your mood and mental state if those are all not in a balance. So what can postpartum anxiety look or feel like? When experiencing postpartum anxiety, some women may feel that they're unable to relax or very restless. Some women may feel nauseous or dizzy. They may experience decreased appetite and sleep. This can all be due to constant worry or fear that something bad may happen. This could eventually take the form of postpartum OCD. Here is a TED Talk presentation, and I really like this because the lady describes how her life looks great on the outside and how it looks like she has everything together and everything going for her, but underneath she is really struggling with that postpartum anxiety and OCD and also those intrusive thoughts. So I think she does a good job of describing how that feels like while having to hide it for her career. As we mentioned before, postpartum anxiety can take on the form of postpartum OCD. This can happen if intrusive thoughts or mental images become consistent. OCD is comprised of obsessions and compulsions. We learned in a prior session that intrusive thoughts are unwanted thoughts that are typically about accidents, contamination, or intentional harm to the child. These are described as obsessions in OCD. Compulsions would be repetitive acts to reduce those obsessions. So going along with some symptoms we could have, it would be maybe unwanted thoughts or images of harming the baby, feeling overwhelmed by obsessions and compulsions, avoiding certain activities with your child, such as going down the stairs or changing their diaper, and compulsions that are hard to control, and those are due to trying to prevent the fears that you have from coming true. So these compulsions can look like consistently checking on the baby, excessive cleaning, and then having constant reassurance. Some risk factors for OCD include, of course, having a personal or family history of anxiety or OCD, a personal history of depression, having a surgical complication in pregnancy or delivery, and then also having a family history of mood disorders or substance disorders. So what does postpartum OCD look or feel like? People experiencing postpartum OCD may end up being less attentive to their child's physical and emotional needs due to constantly having their time taken by doing their obsessions and compulsions, and those can take a majority of their day. Family relationships and friendships can end up being affected due to the need to complete rituals and for the need for constant reassurance. And overall, due to these things, a person's quality of life might be affected by postpartum OCD. So like I said, the identifier for obsessive compulsive disorder is, of course, those obsessions and compulsions. So I thought I would elaborate a little bit more on what those are exactly. Obsessions are the thoughts or fears that a person is thinking about repetitively in their head. Compulsions are the physical acts that someone does to ease their fear or obsession. For example, a person might put their baby down for a nap and be thinking, what if my baby stopped breathing? What if her clothes are too tight on her neck? And the compulsion to that obsession would be to go check on the baby, check for breathing, and adjust their clothing. And this may happen several times within an hour, in a couple minutes, or even throughout the course of that child's nap. Another example I had would be having an obsession about germs. So maybe your child is learning to crawl on the floor at home, and you are worried that if they put their hand in their mouth, they're going to put those germs in their mouth. So the compulsion to that would be to repetitively clean or sweep your floor. As we talked about in a previous session, postpartum psychosis is another serious postpartum mental illness and sometimes can be hard to differentiate postpartum psychosis and OCD. Postpartum OCD comes with obsessions and compulsions that are unwanted and distressing. Postpartum key symptoms are delusions and hallucinations that can cause irrational decisions or judgment. The person in this case thoroughly believes that what they're thinking is true. It is important to get medical attention in order to be properly screened to differentiate the two and receive the proper diagnosis and treatment. So what can we do? It is important to speak to a medical provider as soon as possible if you begin to notice any symptoms. That can be depression, anxiety, OCD, or the psychosis. There is medication and therapy available to you if you need it. Educating yourself about what you're experiencing or may experience is helpful. So even if you're already experiencing some of these symptoms, knowing the reason behind why might help you better understand. And also, if you're planning to become pregnant again at some point in the future, educating yourself on what may occur is super important, and that way you can kind of plan ahead for what your plan of action will be. It is important to be very honest about your thoughts and how you feel about them to your doctor so that they can determine the appropriate course of treatment for you.